Omeprazole is one of the most commonly used medications in the UK and around the world. Millions of people take it every day for acid reflux, heartburn, indigestion, and stomach ulcers. It's widely available, often prescribed by GPs, and even sold over the counter. Because of that, many people assume it's completely harmless. But recently, an NHS GP warning, often referred online as a Dr Amir Khan Omeprazole warning, has brought renewed attention to how this drug should really be used, and more importantly, how it should not be used. This warning is not about panic. It's not saying omeprazole is unsafe when used properly. Instead, it's about long-term use, unnecessary use, and people take it without reviewing whether they still need it. Omeprazole belongs to a group of medicines called proton pump inhibitors, or PPIs. These drugs work by significantly reducing the amount of acid your stomach produces. That can be extremely helpful in the short term, especially for conditions like severe acid reflux, stomach ulcers, or inflammation of the esophagus. However, stomach acid isn't just there to cause discomfort. It plays an important role in digestion, nutrient absorption, and protecting the body from harmful bacteria. When acid production is suppressed for long periods of time, it can start to affect other systems in the body. According to NHS guidance, omeprazole is generally intended for short-term use, often between 4 and 8 weeks, unless a doctor specifically recommends continuing. For over-the-counter use, people are usually advised not to take it for more than 2 weeks without speaking to a healthcare professional. The concern raised in the Dr Amir Khan Omeprazole warning is that many people take it for months or even years without review. Some people take it daily just in case, especially before large meals or alcohol, even when they no longer have significant symptoms. One of the biggest risks of long-term omeprazole use is nutrient deficiency. Stomach acid helps the body absorb important vitamins and minerals. When acid levels stay low for too long, absorption can drop. Vitamin B12 deficiency is one of the most well-known risks. Low B12 levels can cause fatigue, weakness, memory problems, numbness, or tingling in the hands and feet, and anemia. These symptoms can develop slowly and may not be immediately linked back to omeprazole use. Magnesium levels can also be affected. Low magnesium may lead to muscle cramps, tremors, weakness, dizziness, and in severe cases, abnormal heart rhythms. Calcium absorption may also be reduced, which has implications for bone health over time. Another important concern is an increased risk of infections. Stomach acid acts as a barrier against harmful bacteria. When acid levels are reduced, bacteria that would normally be destroyed can survive and reach the intestines. This increases the risk of infections such as Clostridioides difficile, a serious gut infection that can cause severe diarrhea and dehydration, particularly in older adults. Long-term PPI use has also been linked to an increased risk of bone fractures, especially of the hip, wrist, and spine. This risk is higher in people who already have osteoporosis or other risk factors for weak bones. There are also rare but serious side effects associated with prolonged use, including kidney inflammation and certain skin reactions. While these are uncommon, the risk increases along the medication is taken without review. The key message behind the NHS GP warning, and what Dr Amir Khan and other doctors have been emphasizing, is that omeprazole should not be treated as a permanent solution unless there's a clear medical reason. For many people, acid reflux improves with lifestyle changes. Weight management, reducing alcohol intake, stopping smoking, avoiding late-night meals, and identifying trigger foods can all make a significant difference. In some cases, stepping down to a milder medication or using omeprazole only when truly needed may be appropriate, but this should always be done with medical guidance. It's also important not to stop omeprazole suddenly if you've been taking it for a long time. Abruptly stopping can cause rebound acid hypersecretion, where the stomach produces even more acid than before, making symptoms temporarily worse. This can lead people to restart the medication unnecessarily. Instead, doctors often recommend gradually reducing the dose or switching to alternative treatments, while addressing the underlying cause of symptoms. The Dr Amir Khan Omeprazole warning is ultimately about awareness and balance. Omeprazole is an effective and valuable medication when used correctly. It can dramatically improve quality of life and prevent serious complications. But like all medicines, It carries risks when used without proper oversight. If you're taking omeprazole long-term, the most important step is to speak with your GP or healthcare provider. Review why you're taking it, whether you still need it, and whether a lower dose or alternative approach might be safer. This warning isn't meant to scare people. It's meant to encourage informed use. Omeprazole isn't the enemy, but taking any medication without regular review can quietly create problems over time. If this information helps you understand the issue more clearly, consider sharing it with someone who takes omeprazole regularly. Awareness can make a real difference when it comes to long-term health.